This is Mercedes Bernklug with the University of Iowa welcoming you to today's webinar. This is in the series of the Nursing Home Social Work Network's webinar series, and we're happy to have you here with us. Today available on the website, and so you can go to the website and download them. The handouts consist of the PowerPoint presentation that Nancy and Gabrielle will be giving today, say 6 slides per page. So that's what it is. We're going to be emailing certificates of attendance to everybody who has registered for this live webinar through the computer and who's listening through the computer. If you've called in, there's no way for us to track the amount of time that you're on the webinar, and so we can't send you a certificate. But for those of you who are looking through your computers and have registered, the person who registered will get a certificate of attendance emailed to you. And in some states, you can use that certificate toward your CEUs, but not in all states. Recording today's session, and I intend to put the recording up on our website by Monday, so usually in about 24 hours, but since it's Friday. During today's session, please send me a message through the chat box if there's anything I can do to help you better consume today's information. And also, please know that there's a Q&A box that you can put in questions, and then at the end of the presentation, our presenters will address those questions. But you can submit your questions at any time. We're going to have our webinar till the top of the hour, so about 55 minutes our presenters will be speaking. And then after that, there'll be 15 minutes of questions and answers or any comments. And we really do look forward to hearing comments from you. So if anything strikes you as interesting or curious, or you disagree with, or you'd like to have elaborated, please let us know. Give us that feedback. It makes the webinar more lively for everyone. So I want to encourage you to do that. And at this point, I'd like to turn the microphone over to my colleague, Bob Connolly, a social worker with 20 years experience at the Centers for Medicare and Medicaid Services. And in fact, Bob is the project officer for the MDS 3.0 and then worked as a hospital social worker before he joined the CMS staff. And he's the co-leader of this webinar series. So, Bob?
Hi, much, Merce. Today's topic is a very important one to all of us, interdisciplinary teamwork in nursing homes. And especially there was interdisciplinary work among CMS, among consultants, among organizations, certainly down to the patient care area. And we're excited to have, again, Nancy Wilson and Gabrielle Langley speak to you today. They are both experts in interdisciplinary care and really, I think, role models for what good interdisciplinary care should be. So Wilson is an associate professor in the Department of Medicine, Psychiatrics, and assistant director of the Huffington Center on Aging at Baylor Medical Center, also affiliated with the Center of Excellence in Service. And it's also part of the University of Houston Graduate College of Social Work. Her research and education, and she's done all of these, is on advancing interdisciplinary care models of mental health and long-term delivery to elders and families coping with chronic illness, including important ones of depression, dementia, and anxiety. He was a coordinator in her region for the GET project, which is a geriatric evaluation project that team training curriculum based on 7 disciplines. She's got longevity. She's been working in the field. So the speaker is Gabrielle Langley. I think some might have heard my course since 1997. She's been at 7 Acres Continuum Care, working in a continuum care facility in addition to her work as a clinical worker and psychotherapist in mental health. Interestingly, Gabrielle is also an award-winning poet, but we won't hear from that today. So I'll turn it over to Nancy or Gabrielle to take it from here.
Well, good afternoon. I'm deeply to be here with Gabrielle, talking to social work and social service professionals around the country about a topic that I know you live with and try with every day, and that has to do with teamwork. So we are going to team up today. Some of the time I'm going to be reflecting on some key principles and practical knowledge about effective teamwork, and Gabrielle is going to contribute vital information from years of practice and leadership within long-term care about day-to-day realities. So we'll be passing the microphone back and forth and following the slides, but taking intervals in between. Really trying to highlight some things that we think are vital to the challenges of working within healthcare. So I know we can all appreciate that teamwork is all around us. I think over your life right now, beyond what you're doing within the nursing home care, you may be involved in lots of different teams, with the most basic one oftentimes our family members and the group they connect with. And I think we can all recognize that there are teams come in all different versions. They can be large or small. They can be centralized, coming together in one place or on a regular basis, or they can be dispersed. Including with technology, we have virtual teams, so not all of our teamwork is face-to-face, and not all of our team-based collaboration and communication is done in real-time communication. It may be through exchange of information that's done electronically and through record keeping. And so teams come in versions, but one of the key themes of this and one of the key messages about teamwork is it doesn't just happen. Most teams that are effective have worked on some conscious processes, that explicit approaches to how they're going to work together and communicate. And along with the framework of teamwork, we have individuals, often the social worker within the setting, who's thinking, how do I bring people together to address the given needs of a resident or family, or how do I improve care in the unit, or how do I improve care in the overall community from a teamwork perspective. And I will confess to having a strong bias when we source imagery for teamwork. I'm a native Kentuckian and went to school in North Carolina, so as you might imagine, basketball is a common professional team that I think about when I think about teamwork. And curiously enough, I think basketball is one of the best examples of interdisciplinary teamwork, in the sense that we have people who are kind of going in off the court, and this happens in our resident care, people who are part of the team and not part of the team at various points in time, and that people are switching roles. And in an interdisciplinary teamwork, we have to think about what's the best person at the right time for the right situation. The same thing happens in basketball. But one of the things I want to particularly highlight is most effective, high-performing teams in basketball don't just take the court. They've had some prior discussion. They've talked about how we're going to communicate with one another and how we're going to share responsibility. And so I think that's one of the things that is also true about teamwork in the healthcare setting. So just start off briefly in terms of definitional work. Team-based care involves providing services to individuals, family, and the broader community by at least two individuals who are working collaboratively with the residents and their caregivers, paying attention to resident preference, so that how who the resident wishes to work with, how big a team they want to be involved with, and whether they want to be part of that team in any given decision. Shared goals within and across settings to achieve coordinated, high-quality care. And this is a definition modified from the reference shown below. I want to distinguish concepts of different types of teams briefly. Oftentimes we talk teamwork, and then sometimes we talk about interdisciplinary teamwork. And the distinction that's made mostly in the field is that when we're talking about interdisciplinary teams, we're talking about people who may come from different backgrounds with not always one identified leader, but leadership changes and group decisions are made on behalf of plans. And I think this is an important distinction, as opposed to the individual informing the physician or informing the nurse who's going to overall manage the care, but this idea that we're jointly discussing and developing care plans or approaches to a given issue. And so this is, when we talk about interdisciplinary, we're talking about this level of collaboration. If you could tell me personally why you think it's important that we have teamwork in our approach. And again, just highlight a couple of things here. We know that we're asking nursing homes to be involved with increasingly complex needs of nursing home residents, both in terms of the biological needs, but also the psychosocial needs of residents and their families. So oftentimes these issues build over a long history, so that it's chronic care in the context of changing circumstances. And we also know that as social work providers, you're asked to interface with a number of different settings of care, as have residents move from hospital to nursing home to home care, and perhaps back again, or in and out of the hospital, or out of their home residence. That there's a lot of potential interaction with a number of different disciplines and a number of different settings. So in case 100, despite the fact that it's Friday afternoon while you're so tired, it's probably because you're involved with regular complex interactions. So I want to talk a little bit about, as a social work role, I recognize you may be a part of a number of different types of teams. I want to acknowledge that this particular grant comes out of a whole series of curriculum, the reference for which is at the end of the slide, and there's also a website reference here. The Team Steps curriculum that's been developed for a number of different healthcare settings is available in long-term care, and it talks about the different kinds of teams that may exist, and these may all be familiar to you. You may be part of a set of teams that looks at how are we going to handle disasters, and that could be like a contingency team, or you may be part of a coordinating team that looks at how are we going to do quality improvement within our setting around a particular set of issues. But as this graphic portrays, oftentimes we have to start with a key role of the administration supporting teamwork and understanding teamwork, and that's why it's shown here at the bottom. And so one of the challenges we may have as social workers is helping our administration understand how to best support teamwork, and maybe we may have a chance to talk about some examples. But today we're really focusing on the core team. And what do we mean by the core team? It's the group of care providers who work independently to manage care for a set of assigned residents, beginning their admission or their point of assessment into the nursing home setting to the point of discharge or death. And core team members are typically those individuals who have the closest contact with the residents, and so they have a particularly vital role to play in terms of how to engage the resident and the family in the work. And they often have defined regulatory responsibilities for key tasks within the nursing home setting, around assessment, care planning, those sorts of issues. So since we're going to be talking about the core team, we'd like to ask you to take a minute, reflect on who is part of your core team when you think about the individuals that you interface with to provide direct care to residents who you're working with. Who are the members of that team?
Opened up a poll, an electronic poll, so people can go ahead and write down the members of their core team, and then we can see what that is.
Yeah.
Thanks, Merce.
Thank you, Merce.
Gabrielle and I can know. So we don't care spelling or even abbreviations. We probably could recognize some familiar ones. Who's on your team? What disciplines are represented, or what individuals?
So, like on the core team in the facility where I'm working, we have an official team, which is made up of a registered dietitian, an activities therapist, an assessment nurse, a unit RN, and myself, a clinical social worker. But however, also on what I would call the core team, from my perspective, particularly because they're vital sources of information for me when I'm doing my psychosocial assessment, the seniors, the frontline workers, the housekeepers, the maintenance, these are the people who see the residents in their room. So for me, these are the critical core team members, even though they are not sitting, around the conference table looking at the medical records and working on the care plan. They're still core team members. And keep in mind that I work with, as any of us do, in long-term care. Most of my clients have got neurocognitive impairment with significant memory problems. So going and interviewing most of my clients and asking how they felt over the past couple of weeks, what was their mood, they probably cannot remember. So I really need the eyes on the ground, and the more people I embrace as a member of the core team, the better my assessments are, and the better my assessments are, the better my outcomes are.
Any more feedback on this topic?
We're getting some feedback. I must have goofed up something with the because people aren't able to submit an answer in the poll, but people were smart and went ahead and tried the chat box. So we've heard from Jessica that part of her team is the social worker, the neurologist, physical therapist, the occupational therapist, and the therapist. And then Rowan said medical, nursing, social work, dietary, discipline, Q&A box. I think somebody else put it there. Yes, CNAs, LPNs, RC, PPOT. A, I guess nurse administrator, DN, assistant, MDS coordinator, social worker, activities, therapy, RD, and Glenda just wrote in, and let's not forget the resident and the family.
Thanks, everybody. And I think what we're saying is a broad range of disciplines and individuals and roles. And I'm wondering, as we think about it, the challenge we all face, obviously, in our own professions is to understand what competency or skill do each one of those individuals bring, what are their core strengths as it relates to resident care, how do they approach problems. Also, the other part of that is what do they understand about what I as a social worker may be able to do. And I think we all recognize that one of the challenges within our own training and education is we can't begin to understand the scope of everybody's practice. And I can be assured, and I work in a medical school environment, that we face the challenges in having all of our disciplines understand how to best use skills. So this is one of the things you want to have. I'd like you to think about, as you thought about the people you wrote down, do you know you want to know about what they're able to do and not do on behalf of residents? And do they understand what your skills are? And this can often go beyond our professional training, as we know. It can be insights that just come from our own background. As we think about kind of effective team functioning, we know that teams are made up of individuals. We've heard a vast array of ones we've thought about. One of the key elements of effective team functioning is that individuals have clear roles and responsibilities and understand what those are. Part of that, though, is as a unit. How does the team as a unit come together, and do they have a clear shared vision for how they're working with a given individual or how they're working on a given unit? And effective team functioning also often relies on clearly defined and in-place processes. And this is where I think the social work role is particularly vital. training and my learning as a member of interdisciplinary team practice, leadership is not the person who sits at the head of the table or necessarily is in authority in every instance. The mission of leadership and interdisciplinary teamwork is the person who's moving work forward. So I say to myself oftentimes in situations, what can I do to move the work forward? And it could be move attention to this resident's needs forward or move our approach to how we handle behavioral problems. I know there's been a rich discussion on the listserv about these sets of issues. And so what's my role in leading our team? And it can't be a role that's asking questions or doing other things. And Gabrielle is going to contribute some insight on this.
I think this is in some ways paraphrasing what Nancy is saying. She defines it as how the leader is the person who is helping things to move forward. I have a parallel, but I think complementary definition. And to me, the leader showing leadership on a team is the person who is able to influence. And to influence, some of the most influential people are not necessarily, as Nancy said, at the head of the table. So able to influence the direction or outcome, and social workers are in a very unique position to do this because we are trained as communicators and we are trained to listen. That's critical. One of the most effective ways to influence a team is to let the other team members know that they are safe with you. What I mean by that is that you are willing to listen to them and really hear their perspective and their concerns. I think a common mistake that we all make sometimes, myself included, is to jump to the intervention phase before we finish doing assessment. And that's input on leadership is the degree to which we can influence outcomes, and that rests directly on our ability to listen and hear what other people's concerns are, whether it's the resident, whether it's your registered dietitian, whether it's your physical therapist, but to really be here in a listening place for the rest of your team members.
So as we think about leadership as a key element of effective teamwork, other elements that Gabriella introduced and that we can all appreciate is how do we share information and allow true communication to happen, and how can we do that efficiently? We recognize we can't necessarily come together and communicate in real time about every situation that needs to be addressed, but do we have an effective process? And I recognize that there are many mandated requirements within the and within the regulatory practice, and it's not the team has talked about how to do that in a way where it's valued and efficient and still obviously has to address compliance issues. And then what's our processes for problem solving and decision making? How are we going to resolve conflicts? We don't have a lot of time to talk about that today, except for to say that I think this is also an area of social work strength, and the listening can lead to mediation sometimes about different viewpoints. And so other teams are effective teams are really focused on what are the outcomes that we're trying to achieve, and they're making sure that they're looking at feedback around that. One of my favorite things to do as a member of a team is to keep track of recurring problems. This is to be something that comes up all the time, and we're not making headway on it, and so it's kind of like summarizing that issue.
Yeah, linking on to that idea is when you are noticing problems that keep occurring, and I'll give you a practical example of how that happens in a nursing home. Those of you who are clinical social workers know that suicide is frequent. We're always concerned about that. We're assessing for mood issues. And one of the things that I